Hi, I'm Dr. Matt Davis, a primary care pediatrician and the director of the C.S. Mott Children's Hospital National Poll on Children's Health at the University of Michigan. Are you hitting the books hard this year, getting ready for those end-of-year final exams? If you're a teen or you're the parent of a teen, you may be aware that some teens are reaching for study drugs to help them get through this hard time of the academic year. Study drugs are stimulant medicines often prescribed for treatment of attention deficit hyperactivity disorder, and they can be safe when they're used appropriately for treatment of that condition. However, when they're used by kids who don't have a prescription, these study drugs can create big health problems. What we've done this month in the C.S. Mott Children's Hospital National Poll on Children's Health is focus on the issue of study drug use and what parents think is going on in their communities and in their own houses. So when it comes to the use of study drugs, we know from recent data from the Monitoring the Future study that 1 in 10 high school sophomores in 10th grade and 1 in 8 high school seniors in 12th grade say that they've used study drugs at some point to try to improve their academic performance. In contrast, in this month's National Poll on Children's Health, we found that only 1 in 100 parents believes that their teens, ages 13 to 17, have ever used study drugs. That's a big mismatch. Fortunately, it does not mean that parents are not concerned about this particular health problem in their communities. In fact, 1/2 of all the parents nationwide who are in this National Poll on Children's Health said they are very concerned about the problem of study drug use by teens in their communities. Here's the problem, though. Only about 1/4 of parents say that they've talked about the dangers of study drug use with the teens in their own household. If we want to make an impact on the problem of study drug use, we need to do a better job as healthcare providers and as parents of communicating to our teens about the problems of study drug use. Of course, talking with our teens may not be quite enough. We may have to do something about this in terms of policies. And what we found in this month's National Poll on Children's Health is that over 3/4 of parents support a school requirement to discuss the hazards, the risks of using study drugs. In addition, over 3/4 of parents would also support a policy that would require any stimulant medication at school to be kept in a secure location, like a nurse's office. That would effectively remove these medications from the hallways where they can be given or sold from a student with a prescription to a student without. So in summary, it seems like parents in the United States today may not be recognizing the problem of study drug use in their own teens, even while they are concerned about it in their own communities. When it comes to study drugs, there's one very important message to get across. And that's that although study drugs may seem like a good idea when it's time to write those final papers and take those final exams, study drugs at the end of the day are just drugs. And they have the risks that drugs have when they're being taken by people for whom they're not prescribed.